Okay, welcome. So in this video, we're going to be talking about what's sometimes referred to as the four main principles of medical ethics. This is a popular framework, and it's a framework that can help us to think more clearly about the sorts of ethical cases that might emerge for some of you in your work as doctors and nurses and other sorts of healthcare providers. So here's our plan. I want to consider three what we might call classic moral theories in a brief way. These are the sorts of theories that you may have learned about if you ever took an Introduction to Ethics class. And we'll talk briefly about some of the ways in which these theories can be helpful and perhaps less than helpful in the context of medical contexts. After we consider those basic moral theories, we're going to look at four principles of medical ethics. These are known as the principles of autonomy, beneficence, non-maleficence, and justice. And after we get familiar with what these principles are trying to tell us and what sorts of advice that they're giving us, we'll think about the strengths of using these principles when we make ethical decisions in a clinical setting. My source material for today is going to be two readings. One is this paper by Renan Gillen in the British Medical Journal about the four principles of medical ethics. And when I talk about some of the stuff that you might learn about in an Introduction to Ethics class, I'll be drawing from this book, A Concise Introduction to Ethics by Rush Schaefer Landau. So let's take a moment to consider some of the ethical theories that you might learn about in a general ethics class. This isn't all of the theories, but it's a sampling of some of the important ones that you may be familiar with. Kant, a German philosopher from the 18th century, gives us really two principles to guide our living. One is what is called the principle of universalizability. That is, you should be acting on maxims, which is really like principles for living, your rules for life, that everybody could live their lives by. Kant's big idea here is you shouldn't be making yourself an exception to the rules. He's not saying that everybody has to follow the exact same rules, but you have to live by rules that everybody at least could live their lives by. His second principle, and this one's huge, it's called the principle of humanity. It says you should treat other human beings as ends in themselves. Another way to think about what Kant is saying here is you should treat people as people and not simply as things, objects for your manipulation. So to put that in yet other words, we might say that for Kant, to follow the principle of humanity is to respect rational and autonomous beings as rational and autonomous. So you don't go over or act in ways that violate the decisions of another person's rational, autonomous will. So Kant is about fairness and respect for autonomy. Another prominent ethical theory you may have heard of is called utilitarianism. The basic idea behind utilitarianism can be stated in the one rule that they think can make sense of all of ethics, called the principle of utility. The principle of utility says an action is morally required if and only if it does more to improve overall well-being than any other action could have done in the circumstances. Two things to note here. When we're talking about overall well-being, we're talking about not only the amount of happiness and pleasantness that we create in the world, but we also have to think about some of that happiness being canceled out by certain amounts of suffering. When we think about overall well-being, we're really thinking about the surplus of happiness over suffering. So that's the first thing. We want to be focusing on overall well-being. And the other thing that we should notice about this principle of utility is that it says you're doing the right thing only if you do the thing that leads to the best possible result among all your options. The principle of utility is a pretty demanding theory of ethics because it says you can't just do an okay job or good enough. It's saying you're doing something wrong unless you do the thing that makes for the most possible happiness. A somewhat less famous, but a quite prominent theory in ethics was developed in Britain in the 20th century by the philosopher William David Ross. And this is a theory sometimes known as Ross's theory of prima facie duties. Ross's big idea is that different acts are wrong or right for different reasons. So, in the book where Ross develops this theory, he tells us that, well, it's wrong to, for instance, run a person's toes over with your car because that hurts them, right? So in that case, he's going to say non-maleficence explains why it's wrong to hurt people, but he's also going to say that in other situations you might be doing something wrong for a different reason. So he gives, for instance, the duty of fidelity, which is your moral responsibility to stay true to your word. It would be wrong to break a promise out of convenience, but we don't want to explain the wrongness of breaking a promise as like fundamentally the same thing as, hurting somebody. And on Ross's theory, he ultimately works it out that there are 7 kinds of reasons for an act's being morally wrong. Now, you might actually quibble with Ross's list. In fact, one arguable problem in Ross's list is that he does not make explicit room for concepts like equity or equal treatment of people. He also doesn't make any special exceptions to talk about autonomy. So, one thing that we might notice about Ross's theory is that the exact list of prima facie duties might change up, and different people might have different understandings of what the fundamentals of ethics are going to be. But when you're taking an introduction to ethics class, you're going to be looking at these different theories, and you're actually going to see how they give us different interpretations of why different acts are right or wrong. And sometimes these theories are going to give you a specific situation where they're going to give you competing recommendations. Famously, Kant told us that it would be wrong to tell a lie, even if you needed to tell that lie in order to save that person's life from a murderer. Right? So there, Kant would be telling us that you violate the humanity of others and you're doing something that isn't universalizable when you tell a lie. That's why he was against it. Typically, the utilitarian will say, well, obviously you should tell the lie, because if you can save a life by telling a lie, that's probably going to lead to more overall happiness over suffering. And this can be arguably a problem that comes out of learning about a bunch of competing ethical theories, right? Because you might ask yourself, well, some people are Kantians about ethics, some people are utilitarians, some people buy into Ross's theory of prima facie duties. There are other ethical theories. There's natural law, there's virtue ethics, and so on and so forth, right? So what are we supposed to do in these situations where competing ethical theories give us incompatible recommendations? When we take this into the medical ethical realm, we might start to ask, for instance, well, how am I supposed to know what to do if the Kantian theory tells me to do one thing and the utilitarian theory tells me to do another? Well, I can offer one suggestion to this very legitimate worry. I think that we should notice that even though it's very common in an introduction to ethics class to talk about ways in which these theories don't agree and they give competing recommendations, we should also notice that in many cases, competing ethical theories will actually give us the same recommendation. So for instance, Kant and his theory, utilitarianism, and the Rossian theory are all going to be able to give us a way of explaining why it's wrong to murder people, why it's wrong to lie and cheat and steal. That competing theories will actually come to the same conclusion about many cases. The famous 20th and 21st century British philosopher Derek Parfit actually worked out a theory called the triple theory, where he said that three main ethical theories, he was talking about Kant, utilitarianism, and social contract theory. He said that these theories ultimately give the same advice. As Parfit puts it, they're climbing the mountain from different sides. Here's another point. Just because there is a certain amount of controversy about what the right theory of ethics, what the right theory of right and wrong is, we can still use these different theories to articulate what is morally problematic about certain situations and certain kinds of choices that people make. Even though these theories are telling us the necessary and sufficient conditions. So they're basically saying, I can explain to you each and every single morally problematic decision through one or two principles. We can still say, well, we can at least use these ethical theories as sufficient conditions to understand why particular instances of actions are wrong. So we might look at one wrong action and see it as a failure to promote overall well-being, and we might see that as the reason that explains why this action is wrong. But in other situations, we might understand an action to be wrong for reasons that go beyond the contributions of the action to overall well-being. So we might, for instance, notice that an act is wrong because it fails to treat people with sufficient respect. In this way, when it comes to healthcare, we can borrow insights from these competing ethical theories. So for instance, Kant can recommend to us that we enact fairness and consistency. Don't act on one set of rules for yourself and expect others to live by another set of rules. We should also notice that in the medical context, Kant gives us powerful reasons to be very concerned about respect for the autonomy of others. You might also be impressed by the utilitarian's line of thought that says, look, focus on the well-being of others is absolutely crucial when we think about ethics. A big part of acting ethically is about making the world a better place. And finally, we might borrow from Ross's theory of prima facie duties that there's no fixed hierarchy of moral rules. We might think of morality as maybe a number of important recommendations and advice that we have to follow as well as we can, and that we will find ourselves in situations of conflict. Maybe you might even call these situations dilemmas, because we have a number of competing values that sometimes compete with one another. Ross's theory also helpfully, maybe getting away from Kant and utilitarians, Ross's theory tells us that moral judgment requires sensitivity to the nuances of specific cases. So we might, for instance, favor respect for autonomy over concerns about beneficence in some cases, but we might also favor beneficence over respect for autonomy in slightly different cases. In this way, in medical ethics, we are working with prima facie principles, like Ross was dealing with. A bunch of different competing explanations that might explain why some, but not all, acts have certain important moral dimensions to them. So these are the principles that medical ethicists have centered on. Here's the first one, autonomy. It's this idea that we should respect the ability of patients to make well-informed and autonomous decisions. For instance, in medicine, it's often noted that it would be basically battery to treat a patient without their consent. It's also why, for instance, if a patient is not able to give their own consent to a procedure, we want to get consultation from their power of attorney or a proxy, like a parent or a spouse. Furthermore, in medical ethics, we have to be concerned about beneficence, right? We might think that the whole reason why medicine exists is to help to heal people, right? To use the technology and knowledge that we have to solve problems with people's bodies. And in this way, we think that a big part of a doctor's or a nurse's moral calling is to make the lives of their patients better. Right? If we didn't actually make the lives of our patients better through medical intervention, there would be no point in having hospitals at all. Now, a closely related cousin of beneficence is the principle of non-maleficence. The principle of non-maleficence says you should avoid bringing about harm to others. Now, it's interesting that we probably owe duties of beneficence as healthcare workers to our patients. But for non-maleficence, we actually have a responsibility to avoid bringing harm not just to our patients, but to anybody. Consider one example of how beneficence and non-maleficence might actually be in competition with one another. So consider a patient who is dealing with a cancerous tumor. Well, we might realize that the only way to save this patient's life is to surgically remove the tumor. Now, the principle of beneficence says, remove the tumor, right? Because it would be a benefit to the patient to remove the cancer. But in competition with that principle of beneficence, we also have the principle of non-maleficence, avoid bringing harm to others. If you've ever gone through a surgery yourself, or if somebody that you love has gone through a surgery, you know that it can be a very unpleasant thing to go through. If there were no benefit that could be gotten from the surgery, it would be wrong to perform surgery on the patient, right? Because it would be bringing harm, but with no benefit. But if there's enough benefit, so if we can get enough preservation of life and enough good quality of life to a patient, then it might actually be right to subject the patient to certain harms involved with surgery in order to get them the benefit. This can just sort of illustrate how beneficence and non-maleficence can be competing principles that push us in opposite ways. A fourth principle of medical ethics is what we might call a principle of justice. Now, in a certain way, this sneaks in more than just one idea or one recommendation, because if you know much about the history of philosophy or the history of ethics, the word justice means different things in different people's mouths. So sometimes when we talk about justice, we're talking about fair distributions of benefits and burdens. So for instance, this version of justice might say everybody has to pay their fair share when they pay their taxes, but it's also going to mean that everybody in society might be entitled to a certain basic level of quality of life, right? So, every child in America, if America were perfectly just, would receive a certain high quality level of education. So that's one way of thinking about justice. This form of justice about fairly distributing benefits and burdens, that can be thought of as sometimes called distributive justice. But we might also talk about justice as non-violation of people's rights. So for instance, we could talk about it as an injustice if an eligible citizen was blocked from their right to vote. Right? That would be a violation of that person's rights. So we would say that part of justice is figuring out what people's rights are and then making sure that those rights are not violated. But yet another aspect of justice, sometimes justice is thought of as respect for the law, respect for rule of law. So we can think about it as a certain problem or a certain injustice. Say, when a doctor goes against the laws of their hospital or the laws of their country in the treatment of a patient. Here's a fourth idea of justice. It's about treating equals equally and non-equals unequally. So we might, for instance, note that if two people have done the same work in a class, let's say, justice would require that they both get the same grade, right? We can also talk about, justice might also mean treating non-equals unequally. So if I have been caught speeding and you have not been caught speeding, then it actually does make sense that I have a requirement to pay a ticket to the state, whereas you do not. That would be treating non-equals unequally. So I think that you might already see the way in which these four principles can be really useful in making sense of not only how to work your way through a difficult ethical decision in the context of healthcare, but sometimes it might also help us get a grip on certain debates, right? So we might think about sometimes autonomy and beneficence in competition with one another. Do we do what's best for the patient, or do we do what the patient is asking of us? Or do we give a benefit to a patient even if it breaks certain rules of justice, such as the idea that, would it really be a fair distribution of benefits and burdens if we gave one patient, say, the vaccine that everybody wants early, letting them cut in line? Well, we might think, well, there's beneficence there, but on the other hand, there's injustice in the situation, pulling us in the other direction. So a big part of what is interesting and important about these four prima facie principles of medicine is that they give us a way of making sense of difficult decisions. But it's not as if this is a simple formula that tells us exactly what to do in every single situation. So we get these difficult questions about who we owe it to follow these principles. Gillen, in your reading, points out that oftentimes within a medical setting, the duty of beneficence is owed to perhaps all of your patients. You have duties to help those and relieve the suffering of those who have been taken on as the patient of a healthcare provider. If somebody else is not your patient, it's not your job to advocate for that individual. Right? So that might be one important question about the scope of these ethical principles. We might say that beneficence is owed to your patients. But we might also notice that non-maleficence, this avoiding bringing harm to others, might be owed not just to your patients, but to maybe anybody that your actions might have an effect on. So for instance, if you were to spread a deadly new virus throughout society, well, that would be wrong, and largely through non-maleficence, because you might be harming people. Even though they're not your patients, it would still be wrong because the scope of non-maleficence is much wider. We might also notice that in order to apply these principles well, we actually have to start reflecting pretty deeply about what some of these key concepts mean. So for instance, if we have to respect the autonomous decisions of patients, well, we have to ask, what does it mean for somebody to be acting autonomously? We can also start to ask, what a benefit to a patient is. Does it make them healthier by some objective measure, or is it just giving them what they want? We noticed in the theory of justice that one part of justice is going to be the non-violation of people's rights. Well, we can start to ask questions about what a person's rights are. Some questions might be easy. For instance, that everybody has a right not to be medically treated over and above their objections, especially when they're rational and autonomous. But we might, on the other hand, wonder whether a person has a right to receive any treatment that they're asking doctors for. But we might also ask if a person has a right to receive any treatment that they ask their doctor for, or whether there's some baseline level of provisions that are also included in your rights. So these principles can be a helpful guide, but they still leave room for a bunch of really interesting and important philosophical questions. So why are the principles helpful? Well, as I've already suggested, as a framework, these principles are a really helpful way of organizing our ethical thinking about most, perhaps the vast majority of bioethical cases. And when we come to difficult cases, we might understand them a little better by understanding them, say, as conflicts between things like autonomy versus beneficence. Do we do what's good for the patient, or do we give the patient what they've rationally asked us for? We might also ask questions about what I was calling the scope of a principle, right? That's the question about how far does justice go? what does justice really mean? Or who do we have duties of beneficence to? Another thing that we can say about these 4 principles of medical ethics is that they're based on what's sometimes referred to as a common morality. We can think about the fact that a lot of moral questions in this life and in our society are quite contentious ones. Some people are strongly in favor of unrestricted abortion rights. Some people are strongly against almost any abortion rights. That's a matter of contention. What we find when we look at these principles of medical ethics is that just about everybody can buy into autonomy, beneficence, non-maleficence, and justice. And that's true irrespective of your religious, cultural, political, and philosophical differences. Talking about philosophical differences again, you will find some pretty deep and important differences and disagreements between utilitarian moral theorists and Kantian moral theorists. But if you talk with Kantians and utilitarians about the importance of autonomy, non-maleficence, beneficence, and justice, they'll say those are all important things that we need to be thinking about when we make ethical decisions in healthcare. Whereas we might try to find all the disagreements that we can in an intro to ethics class where we're looking at competing theories, we should also notice that there's a lot of room for consensus. And oftentimes when we are making professional ethical decisions, we have to be working with people who are from different religious perspectives, different cultural or political or philosophical upbringings. But we should think of it as a welcome thing that there are opportunities for consensus when it comes to these 4 principles. Again, autonomy, beneficence, non-maleficence, and justice. So, to recap, it is true that ethical theories often compete with one another and disagree with one another. But these 4 principles that are commonly appealed to in medical ethics are drawing insights from all of the competing theories, right? So, in fact, we're borrowing some influence from Kant when we emphasize the importance of autonomy. We are borrowing some influence from the utilitarians when we focus on bringing benefits to others and avoiding harm. And we are borrowing something from W.D. Ross when he says, look, there's not just one simple rule. In fact, it's a complex group of considerations that need to be on the table when we figure out what the right thing to do is. So in this way, when we start thinking through these 4 principles, we find a lot of opportunities for consensus in medical decisions. And oftentimes, where the philosophical work gets done in medical ethics and bioethics isn't about figuring out what the one true ethical theory is and then just cranking out the answers to a bunch of different cases. A big part of what we do in medical ethics is we start to think about the meaning and the scope of the application of these big important principles. And when we start looking at difficult cases, it's going to have us reconsidering, well, what does it really mean to be autonomous in your decision making? What are we really focusing on when we talk about promoting the well-being of others? So that's sort of just a keyhole into a helpful framework for ethical decision making in medicine, and maybe just a little hint of how these conversations are still going to be complex and philosophically rich through the application of these 4 principles.